Welcome. I'm Denise Barrett, Manager of the Regional Disaster Preparedness Organization of the Portland Metro area. Today I'm going to introduce you to RMACS, the Regional Multi-Agency Coordination System. You'll learn how our regional partners can work together after a major disaster that impacts one or more jurisdictions at a level that requires special coordination and decision-making. This video will explain the purpose of RMACS and clarify the roles, responsibilities, and relationships within it. You might be wondering, why do we need it? Our jurisdictions in the 5-county region are interconnected and interdependent. During a prolonged and complex event, common needs and issues can arise. Working together, rather than separately, to resolve them, can help ensure consistent, equitable actions and outcomes for the region. So, what is RMACS? It's a combination of facilities, people, and processes that are used when a disaster affects multiple jurisdictions, or when a single jurisdiction is overwhelmed and needs support. It provides a framework for coordination across jurisdictional boundaries to support equitable emergency response at the local level. But it does not supersede local authority. To reiterate, it allows for multi-agency coordination, not command. RMACS is maintained by 3 coordinators. Currently, they are Denise Barrett, Manager of the Regional Disaster Preparedness Organization; Catherine Richer, Manager of the Northwest Oregon Health Preparedness Organization; and Melissa McKinney, Regional Program Coordinator of the city's Readiness Initiative. The coordinators oversee ongoing planning and training for RMACS, and we play an important role coordinating parts of RMACS during activation. So, how does RMACS work? It's a system that's entirely scalable and customizable. Parts of the system are activated according to the complexity and needs of the emergency. In most small-scale emergencies, a city or county may not need support. But as complexity increases or an emergency impacts more than one jurisdiction, the level of support can be scaled up. For small to medium-sized events, RMACS activation may include use of the Regional Logistics Support Team, EOC or ECC support, or use of the Regional Joint Information Center. As an incident grows or intensifies, the Regional All Hazards MAC group may be activated. This is when agency representatives, or AREPs, from the impacted jurisdictions get together to make important decisions. A coordinator facilitates the RMAC group processes and procedures. If the incident is large enough, the Regional All Hazards MAC group may assemble a Regional MAC Support Organization, or MSO, to assist them. They may also find a facility to use as their Regional MAC Coordination Center, which will host both the Regional All Hazards MAC group and the MAC Support Organization. Let's talk more about what that Regional All Hazards MAC group does. They'll be activated when decision-making is needed for the good of the region, including cross-jurisdictional information sharing, incident prioritization, resolution of regional issues, scarce critical resource allocation, creation of policy recommendations, and supporting consistent, accurate regional messaging for partners and the public. To review, RMACS is the overall system. One or more of its components may be activated depending upon the type and complexity of an emergency. And sometimes if the disaster requires it, a discipline-specific MAC group may activate, such as the Health Medical MAC or the Animal MAC. A request to activate the Regional All Hazards MAC group or one of the single-discipline MAC groups can come from a senior official, agency administrator, emergency manager, or incident commander. County emergency managers will reach consensus on which elements of the RMACS to activate. Now, let's dig deeper into who is involved in RMACS. It depends on the nature of the incident, but in full deployment, RMACS includes the following players. Agency administrators are elected officials. Essentially, county boards of commissioners, who approve activation of the Regional All Hazards MAC group. Through written delegation of authority, they appoint agency representatives to run the Regional All Hazards MAC group. Ideally, this is done ahead of a disaster. Agency administrators also interact with the Regional All Hazards MAC group by recommending issues to be addressed, implementing decisions, and providing approval of policy recommendations. Agency representatives, or AREPs, make up the Regional All Hazards MAC group. They represent their jurisdictions, and they work together to prioritize incidents and make decisions, such as how to allocate scarce resources and create policy recommendations. They may consult with subject matter experts who informally provide advice and input. And assisting or cooperating agencies such as fire, law enforcement, public health, infrastructure systems, utilities, human services, NGOs, etc. The Regional MAC Coordinator supports and facilitates the Regional All Hazards MAC Group. They also manage the Regional Multi-Agency Coordination Center, and they assemble and supervise the Regional MAC Support Organization, MSO, otherwise known as the support staff, which includes a planning section chief, a logistics section chief, and a public information officer, as well as other associated staff. Other players include the Regional Joint Information Center staff and the Regional Logistics Support Team. There are other discipline-specific MAC groups that may be activated and/or consulted depending on the nature of the incident, including our Regional Health Medical MAC Group and Animal MAC Group. So, who has what authority here? Agency reps should have full authority from their agency administrator to make decisions on behalf of their agencies. Subject matter experts do not have decision-making authority, nor does the MAC Group coordinator, and remember that no agency loses its jurisdictional authority. The Regional All Hazards MAC Group makes decisions by consensus, and those become multi-agency decisions for the incident. Let's look at an example of how this might work. A fire starts in the Mount Hood National Forest near Bull Run Reservoir No. 2. It quickly begins to spread westward into Clackamas and Multnomah counties. The fire threatens Sandy and Gresham, and the smoke quickly begins to impact the entire region. The State Fire Marshal and the Pacific Northwest Multi-Agency Coordination Group begin their work creating a plan to contain the fire. But emergency managers in Clackamas and Multnomah County realize that communities west of the fire are going to need to be evacuated. Shelters will need to be set up, power and water will be impacted, security will be needed, and public health matters will need to be addressed. They activate their emergency operations centers to support emergency response. Multnomah County's Emergency Management Director contacts the emergency management directors from Clackamas, Clark, Columbia, and Washington counties. They agree that full RMACS activation is needed, including the Regional All Hazards MAC Group, the MAC Support Organization, a Regional MAC Coordination Center, discipline-specific MAC groups, and other experts. They contact their county commissioners to confirm and officially begin activation. The Portland ECC agrees to house RMACS operations. The three coordinators are activated, and a support organization is put into place. A coordinator calls on her planning section chief to provide completed incident prioritization sheets. Then, she calls the first formal meeting by phone of the Regional All Hazards RMAC Group, including agency representatives, liaisons from discipline MAC groups, such as the Health Medical and Animal MAC groups, select subject matter experts, and representatives from cooperating organizations. During the call, the Regional All Hazards MAC Group defines their mission and arrives at key decisions based on situational status reports and incident prioritization sheets. Over the next few days and weeks, they make dozens of critical decisions. They share information regionally, prioritize incidents, equitably allocate scarce critical resources, ensure consistent, accurate public messaging, and implement several regional law enforcement and public health policies. Their cooperation results in greater efficiency, more informed decision-making, more effective and cohesive communication with the public, and more equitable outcomes for the region. You may wonder, how do they ensure equitable outcomes? The RMACS uses an ethical framework. Its four cornerstone values are prudence, respect, justice, and the common good. Valuing justice means considering what's good for the whole community and recognizing the disproportionate impacts of disasters on traditionally marginalized groups. Strategies to ensure equitable decision-making are evolving and will be a core focal point as the RMACS evolves. Thank you for watching. You can access other videos in the RMACS Just-in-Time training series on our website. There you will also find the RMACS Concept of Operations Plan, handbooks for the Health Medical and All Hazard MAC groups and support organizations, and other RMACS plans and tools. Bye.